Now at 5, chances are you know someone who's sick or a number of people who are sick, or you're feeling under the weather yourself. There are so many things going around right now that doctors are actually calling it a quad-demic. That is 4 viruses on the rise since November: COVID, flu, RSV, and the norovirus. Your reporter Dylan Farron has more on the people getting sick and ways to prevent it from happening to you. Dylan.
Well, Aaron, it's winter, so doctors aren't surprised in the rise in cases, but there has been a rise in hospitalizations as well. And doctors say they won't be shocked if they see more people walking around with masks if they're sick and they still need to go out. Dr. David Bannock specializes in infectious diseases at UConn Health. He's studying the high influenza rate in Connecticut the past few weeks, adding COVID and RSV cases are up too.
This year, we are seeing high rates of flu activity. It's been among the higher side compared to recent years in terms of the amount of virus that's been circulating. We're optimistic that we're near or at a peak, but we'll have to see moving forward.
Sick people are in the hospital suffering from those viruses right now, typically older patients with underlying medical conditions, and the excruciatingly painful norovirus, sometimes known as the winter vomiting virus, is trending up too, according to the CDC. Nick Deathlison is hoping he already suffered through his annual illness.
Every year around the holidays I get nailed with something. And this year I got a stomach bug. It was no fun. So, wash your hands, take care of yourself.
And Angie Smith, visiting from Texas, isn't too worried.
I think flu. People will say, oh, I think I have the flu, but they don't go to the doctor for it and they just get better at some point.
The hope is the case numbers start trending down as we're well into the second half of flu season. The cold weather to blame, more people inside, indoor transmission much greater than outdoor. And we're told vaccine and flu shot rates aren't quite where doctors would like to see them, all factors leading to an increase in cases and hospitalizations. Dr. Ulysses Wu is Hartford Healthcare's chief epidemiologist.
Try not to get other people sick. Maybe don't go to that party. Maybe don't go to that concert. Maybe don't go out to dinner. Maybe not go to work.
And we're starting to receive some data from the Connecticut Department of Public Health tonight, Mark and Aaron. More than 3,700 people with the flu in Connecticut over the last 2 weeks, nearly 800 people with COVID in our state over the last 2 weeks. We're hoping to compare that data from this year to last year and previous years, and we will once we receive more data from the Department of Public Health. I'm your reporter live in Farmington, Dylan Farron, Channel 3 Eyewitness News.
All right, Dylan.